Hi, this is Dr. Randy Goldstein. This is a short talk on splinting. Hopefully you never have an injury in the gym, but if you do, you want to know the safest way to get them from the gym to an x-ray if needed. So here we go. You can spend lots of money on splints. The splint in the middle at the top of the page is a special splint for the lower extremity. You might pay somewhere between $40 and $100 for this splint. The Sam splint, which is a popular brand, but they come in multiple different products, is on the top left. And that might be somewhere between $10 and $30. And it can be used for many parts of the body. The least expensive splint is on the top right. It's a magazine folded up. We'll talk about it a little bit later. So when should you consider splinting? Well, if an athlete gets hurt and doesn't want to use that extremity, you should at least consider it. If the extremity joint looks funny, it's disfigured or swollen, you should really think about it. And if the bone is out of place, or certainly if it's sticking out, this is an emergency. An open fracture is when the bone pokes through the skin, and it doesn't have to necessarily be showing. It could have just quickly poked out, put itself back in, but the bleeding area or the small puncture wound right next to the disfigured or funny looking bone should be considered an open fracture. When it's an open fracture, you should call an ambulance for help and not take care of that by yourself. Before splinting an athlete, the first thing that should be asked is it safe to move forward or should you be getting more help? Here's two things to consider before splinting and perhaps thinking about calling an ambulance or 911. Is the athlete in shock? Now, shock has multiple definitions, but for the purposes of this slideshow, shock is an athlete that's not acting safe. So not only is there an extremity injury, but perhaps they're breathing abnormally, or not at all. They're not acting normal. Now, most athletes after they're injured might cry, but they should still be able to answer questions. And so if they're just staring forward and not answering your questions, that's very concerning. And often athletes sweat during sport, but if they're pale and sweating, could that be that they're about ready to pass out? In those cases, it's better to have medical personnel available at the site. The second question is it an open fracture? Now, if a bone is sticking out, that's an open fracture. But sometimes during an injury, the bone will pop out for just a second and then hide itself. If there's a puncture or a pierce wound next to the disfigured extremity, that should be considered an open fracture, and calling 911 is safest. Well, that's unusual for there to be shock or an open fracture. So, assuming those things aren't happening, the first thing to do is to check a pulse. The pulse in your wrist is on the palm side next to the thumb and shown here. Check yours to see if you can find it. And in the lower extremity, there's two pulses I typically look at. One is at the top of the foot next to the ankle on the top side, and then between the first and the second toe in the midfoot. See if you can find yours or one of a friend, so you can know what it feels like when you're looking at it for it during an injury. Finally, check sensation above and below the injury. If it's an elbow injury, make sure they can feel when you push on their shoulder and make sure they can feel when you rub their wrist or hand. If any of these things are missing, then you should be getting help, perhaps calling 911. Capillary refill is the blood flow into the most distal or furthest away from your heart part of your extremity. In the upper extremity, it would be your finger. In the lower extremity, it would be your toe. Squeeze your fingernail. It should turn pale, and then return its color within 2 or 3 seconds. In a cold room, it may take longer, but in a normal temperature, squeezing your finger will turn pale and then return in 2 to 3 seconds. Longer than that, the blood flow may be interrupted because of a bone squeezing against a vessel, or because the vessel was injured. This is usually more serious, and calling 911 may be the best approach. If the cap refill is prolonged, you can't feel a pulse, or they can't feel you touching them above or below the injury. Well, let's start with the easiest one, splinting a finger. Unless it's dislocated or the bone is sticking out, the best way to splint a finger is buddy taping. Here it's shown with Coban or flexible tape. Put it above and below the joint, but not over the joint. So if they wanted to, they could still bend their finger. Notice the knuckles are still showing through the two blue tapes. This is a pretty safe way to get them from the gym to an x-ray. And usually 911 doesn't need to be called for a finger injury. Unless the bone's sticking out, an open fracture still deserves to have an ambulance called. Here's an example of splinting the wrist. This is a pretty common injury, especially in gymnastics, if the athlete forgets to hold their arm up and accidentally puts it down during a fall. Different fractures can occur during this, and that's not really the purpose of this talk. But just know that fractures aren't always swollen and aren't always disfigured. Those are the easy ones to pick up that might be fractured. But a buckle fracture may just have pain, and they may just point to the wrist, and an x-ray is still appropriate, especially in the growing athlete. Here, these gutter splints are shown protecting the wrist and the elbow. You can see the fingers curled over the folded up SAM splint, and then it's secured with tape or saran wrap, and it would be safe to go from the gym to the urgent care or emergency room. But if you don't have a SAM splint, look for them online. They're not very expensive. But if you don't have one, consider a magazine. Have some magazines just in a bag or box in the corner of the gym. And in an emergency, it can be folded up just like it's shown in the above pictures and taped or saran wrapped to the extremity for safe transport for an x-ray. An elbow, we often use a sugar tong splint, and it's shown here. Magazines can be used for this as well, but a SAM splint or a sugar tong splint certainly make it easier. For the ankle, we also use a sugar tong splint, and here it is shown here. You can also use a posterior gutter splint. This is particularly good for Achilles or back of the ankle injuries. The knee's a harder joint to splint just because it's a larger joint, but in your smaller athletes, the SAM splint can be used, a magazine can be used, or you can purchase a larger splint that can be used in an emergency. After it's splinted, you should go through the same checklist before sending them outside the gym. Should I call 911? Has the athlete gotten more ill or more traumatized during the splinting? Are they breathing abnormally or acting abnormally? Are they about ready to pass out? Having a parent transport their child to the emergency room and they pass out on the way or have breathing trouble on the way is not what you want. If you think that's going to happen, call 911 and have an ambulance help them get to the hospital. That's unusual, but keep it in the back of your mind to check before they leave. Ask mom, are you okay? Before they drive. You don't want the parents getting in a car accident because they're driving recklessly or worried about their kid in the back seat. Ask the kid, are you okay? If it looks like they're going to pass out or they're having trouble breathing, probably better not to put the parent in charge of driving and getting their child safely to the emergency room. Well, let's say that's fine. You should still, after they've been splinted, try to find a pulse. This may be hard to do if the splint's covering up the area that you want to check. If that's the case, recheck the capillary refill. That's a pretty good way to make sure that there's blood flow going to the end of the extremity. And ask them again about sensation above and below the injury. These are reasons why maybe calling 911 if it's abnormal is safer than sending them by car. Put an ice bag over the splint. Now, it won't be as cold as the ice being directly on the injury, but the ice will chill the splint and eventually make it slightly cold. So by the time they get to the emergency room, there's a little bit of swelling control from the pressure of the splint and the ice. And before we end, I should mention pressure of the splint. It's really important to ask about sensation and cap refill, and if you can get to it, a pulse after the splint's been applied. Certainly you're not doing it on purpose, but there are situations where the splint actually cuts off blood circulation, or because of the fracture, the angle that you put the splint on causes a disruption to the nerve, check for sensation, or the blood flow, check for pulse if you can, and especially capillary refill. Changing those things with splinting is potentially dangerous, and you'd want to know it before you sent them in the car. But as long as there's a pulse, if you can find it, cap refill certainly, and sensation certainly, Well, it's probably fine to send them with their splint, put them in the car, and have them go to the emergency room for an x-ray. Don't wait till the next day. Send them now. A splint is a temporary treatment, not a permanent one or one that's really used for long-term cure. So once you've put the splint on, you've taken some responsibility for the injury. And you want the next person, the medical provider, to make the decision of whether a cast is necessary or nothing at all. But having a splint on for a long period of time before the x-ray, you may look back and wish that a medical person had been involved sooner, especially if surgery is necessary or a reduction, putting the bones back in the right location, is necessary. So make sure the parent understands the splint is just to get from the gym to an emergency room, not for long-term treatment. I hope this was helpful, and if you have any questions, email me, rgoldstein@wellbodykc.com. Be safe.